Hello, everyone, and welcome to week 5 NUR 410. I am your professor, Dr. Marion Johnson. Great job, everybody. Thank you for everybody that also watches. Appreciate it. So 410, nursing research, reading, using, and creating evidence. I hope everyone is working on your research projects. Any questions? Text me, call me, email. Email is still not working, so just don't wait too long. Let's get started. Week 5, enhancing the validity of research. This week we're going to concentrate on 2 topics. So in this lecture, we'll be enhancing the validity of research and descriptive research questions and procedures is your reading assignment. Enhancing the validity of research. Whether developing a research study, reading a research report, or contemplating the use of research findings, the challenge is to determine whether the intervention or manipulation of the variables actually cause the desired outcome or result. Internal validity refers specifically to whether the researcher and the reader can be confident that the experimental treatment or condition made a difference, and whether rival explanations for the difference can be systematically ruled out. Internal validity is about the strength of the design and the controls that were placed on the experimental situation. In contrast, external validity is about applicability and usefulness of the findings. Internal validity, the confidence that the experimental treatment or condition made a difference and that the rival explanations were systematically ruled out through study design and control. Once again, external validity, the ability to generalize the findings from a research study to other populations, places, and situations. For example, we might want to know if a particular exercise and diet program actually results in a significant weight loss, and that no other reasons account for the weight loss except the exercise and diet program. If the findings are credible and trustworthy, we also want to know if the results can be generalized to a different or larger population. Before determining if there is a causal relationship between the outcome and the intervention, 3 conditions must be met. Changes in the presumed cause must be related to changes in the presumed effect. If the treatment is changed in any way, the outcome will change. In the example, if the exercise and dietary program are changed in any way, the weight loss will change. The presumed cause must occur before the presumed effect. In other words, the treatment or intervention must occur before the outcome. The weight loss must occur after the exercise and dietary program is introduced. There is no plausible alternative explanations. No other factors could be possible from the outcomes. In the example, nothing can have occurred that might have caused the weight loss except the prescribed exercise and dietary intervention. Good research design reduce the possibility of alternative explanations for results. These alternative explanations for the outcome are often referred to as threats to internal validity. Several methods can be used to minimize threats to internal validity. Measurement or observation, use of appropriate design, control of bias, and statistical analysis. Measurement or observation. Measurement or observation is one possible method to rule out threats in internal validity. This method can demonstrate that the threat either does not occur at all or occurs so infrequently that it is not significant. It is not a significant alternative explanation. In a study designed to determine the effects of music on agitation in a sample of hospitalized patients with dementia, for example, the music did reduce agitation. An alternative explanation for this outcome may have been the effect of visitors on the patients. However, excuse me. Sorry, excuse me. However, some designs are not appropriate for dealing with specific requirements of a research problem. If the researcher wishes to determine whether music is effective in reducing anxiety in patients undergoing radiation therapy, a repeated measure design might be effective, whereas a survey design might not reveal any significant effects of the music intervention. An observational study might be appropriate if the researcher is concerned about the effects of ibuprofen on activity levels in a population of senior citizens. The same study will not be appropriate if the researcher is concerned with the subject's perception of pain and activity. Choosing the correct design to answer the research questions is fundamentally necessary to control the threats to internal and external validity. Control of bias. Good design is also dependent on the absence of bias. Bias is introduced into research studies through three major areas: the way the sample is selected and designed to treatment groups, sample and error; the way the treatment is applied to the treatment group, treatment effects; the way the outcome is measured, measurement error. Bias can occur in the recruitment of subjects, assignment of subjects into groups, or actions of the researcher. In tightly controlled experimental research, double-blind procedures will help to limit researcher bias. However, blinding is not always possible. Using more than one observer or interventionist can help control control for this bias, but it can also produce experimenter or inter-rater reliability effects. This is a common problem that threatens the internal validity of research. Protecting against one type of bias has the associated effect of creating another type of bias. Balancing the risk becomes a task for the researcher. Self-selection bias can be a threat to a good design and can produce misleading results. Differences exist between subjects who volunteer to participate in a research study and those who are randomly selected, and these differences may not be immediately apparent. For example, the results of a study to determine the effects of prayer on anxiety in pre-surgical patients must be skewed by individuals who pray regularly. A carefully constructed demographic questionnaire might help to reduce this threat. A similar concern arises if subjects self-select into the control and intervention groups. For example, subjects who believe that massage will benefit their joint pain might choose to have the treatment, running the risk of a placebo effect. Subjects who are skeptical of the effects of massage might elect to avoid the treatment, creating artificial negative results. Randomization into groups greatly reduces the risk. A broad range of potential methods and designs exist. and each option provides protections against some kind of bias. Although randomized controlled trials are commonly held up as the strongest in terms of control and bias, even they have potential sources of bias that must be accounted for. When threats to validity cannot be eliminated or controlled, then their effects must be quantified. Statistical analysis can help determine the amounts of error and variability that is introduced by controlled threats to validity. Statistical analysis. The following list identifies some of the many ways to strengthen validity by using statistical analysis. Testing null hypothesis, determining the probability of type 1 and type 2 error, calculating and reporting tests of effect size, ensuring data meet the fundamental assumptions of the statistical test. Testing the null hypothesis. When attempting to determine if an outcome is related to a cause, it is necessary to know if the outcomes or results could have occurred by chance alone. This cannot be done with certainty, but researchers can determine the probability that the hypothesis is true. Understanding the definition of a null hypothesis is antecedent to this discussion. The null hypothesis, the HO, states that there is no differences or there is no actual relationship between variables. Any observed or measured relationship happened by chance or because of the sampling variations. This definition is based on the concept of probability or the question, how likely is it that the results are just a matter of chance? Rejecting a null hypothesis is a statement that the intervention had an effect on the outcome. Accepting a null hypothesis is a statement that there are no differences in the outcomes based on the intervention or observation. That is, there is no cause and effect relationship. Using a null hypothesis enables the researcher to quantify and report the probability that the outcome was due to random error. For example, suppose the null hypothesis in a study states that the level of suffering in a sample of women with breast cancer will not be affected by the presence of a support system. The results of the study indicate that married women report less suffering than women who are not married. In this example, the null hypothesis has been rejected. In fact, the presence of a support system seems to predict less suffering in this example. Determining the probability of type 1 and type 2 error. Before accepting these results as evidence for practice, however, the probability that an error was made should be evaluated. This assessment, coupled with the results of the hypothesis test, enables the researcher to quantify the role of error in the outcome. There are two types of error. Type 1 error is the rejection of a true null hypothesis. In other words, the researcher draws a conclusion that the intervention had an effect when in fact it did not. Type 1 error usually occurs as a result of weakness in the design, because the cause of type 1 error is usually an uncontrolled extraneous variable. Type 1 error is considered a serious flaw and threatens the overall internal validity of a study. An example of type 1 error is the following. Often called alpha and referred to as the level of significance, this error is the rejection of a true null hypothesis. The researcher erroneously draws a conclusion that the intervention had an effect. Two groups of students were taught statistics using two different methods. The data that Group A achieved significantly higher growth scores than Group B. The null hypothesis is rejected. However, Group A includes subjects with higher math ability, and the teaching methods did not make a difference. Rejecting HO in this case is a type 1 error. The differences in the scores were not based on the teaching methods, but rather were caused by extraneous variables, previous math ability. Type 1 error is called alpha. The term that would be my cat opening the door and going down the stairs. I'm sorry. Possible extra point question. Who opens my door? My cat Husky. Okay, sorry. Lost my train. Okay, where was I? The term level of significance is simply the phrase used to indicate the probability of committing a type 1 error. The maximum acceptable level of alpha in scientific research is generally 0.05. However, 0.01 may be chosen if the decision has important consequences for treatment. Alpha is set by the researcher a priori, meaning before the experiment begins. The level of alpha is based on a thoughtful consideration of the stakes of being wrong. For example, an intervention that is intended to improve self-esteem may have an acceptable error rate of 5%. A test of a tumor-killing drug may be more appropriate at 1%. Alpha is used as a standard for comparison for the p-value or the probability of a type 1 error that is yielded from most inferential statistical tests. When the calculated probability of type 1 error, the p-value, is less than the acceptable level of a type 1 error, alpha, then the test is considered to be statistically significant. Type 1 error is quantified then by the p-value. Type 2 error is the acceptance of a false null hypothesis or the statement that there are no differences in the outcome when, in fact, there are differences. An example of type 2 error is as follows. Type 2 error, often called beta, and related to the power of a statistical test. This error is the acceptance of a false hypothesis. The researcher erroneously draws a conclusion that the intervention had no effect. A study was conducted to determine whether breastfeeding or bottle feeding contributed to the greater maternal fatigue in the first 30 days after birth. The researchers were able to recruit 30 breastfeeding mothers into the study, but only six bottle feeding mothers consented to participate. No differences were found between the groups. The research reflects a type 2 error in that a difference may have been present, but the small sample did not enable the researchers to discover it. A type 2 error is called beta. The probability of obtaining a significant result is called the power of a statistical test. A more powerful test is one that is more likely to detect an outcome of the interest. Type 2 error can occur when an experiment has insufficient power. It means that a treatment was effective, but the experiment did not reveal this condition. The best way to control type 2 error is to ensure that the sample is large enough to provide sufficient power to the experiment to illuminate the findings. Type 2 error is calculated as beta 1 or 1 dash power. For example, if the sample enables the researcher to document 90% power, then the probability of type 2 error affecting the outcome is 10%. The nurse may consider this question. Which type of error is worse? In healthcare, type 1 error is generally considered more serious. Such an error will lead the researcher to believe an intervention is effective when it is not. Focusing solely on tight controls of type 1 error means the significant findings may be overlooked. The relationship between type 1 and type 2 error is paradoxical. As one is controlled, the risk of the others increases. Both types of error should be avoided. Missing the opportunity to apply an effective treatment because its effects cannot be detected is unfortunate for patients and researchers alike. The best approach is to carefully consider and control sources of bias, set the alpha level appropriately, use an effective sampling strategy, and select a solid design for the question. Getting all these elements aligned requires a balancing of risks and benefits that is the task of the primary researcher. Calculating and reporting tests of effect size. Effect size must also be considered when evaluating the validity of a study. Effect size refers to how much impact the intervention or variable is expected to have on an outcome. Even though an experiment might yield statistically significant results, these may not translate into clinically important findings. An example of the impact of effect size is the following. The magnitude of the impact that the intervention or variable is expected to have on the outcome. Researchers want to determine the effects of aerobic exercises on heart rate in a sample of subjects with chronic supraventricular tachycardia, SVT. The researchers are specifically measuring the relationship between aerobic exercise and heart rate. If the relationship is strong, an effect will be detected even with a small sample size. Conversely, if it is determined that the exercise has little effect on heart rate in patients with chronic SVT, a much larger sample would be needed to find any significant changes in heart rate in the study. Large effect sizes enhance the confidence in findings. When a treatment exerts a dramatic effect, then the validity of the findings is not called into question. In contrast, when effect sizes are very small, the potential for effects from extraneous variables is more likely, and the results may have less validity. Ensuring fundamental assumptions are met. Data analysis is based on many assumptions of the nature of the data, the statistical procedures that are used to conduct the analysis, and the match between the data and the procedures. Erroneous conclusions can be drawn about relationships if the assumptions of the statistical test are violated. For instance, many statistical analyses assume that the data obtained are distributed normally. That is, that the population is distributed according to a normal or bell-shaped curve. If the assumption is violated, the result can be accurate, an accurate estimate of the real relationship. Inaccurate conclusions lead to error, which in turn affects the validity of the study. Factors that jeopardize internal validity. A good research design controls factors that jeopardize validity. A host of events and actions can threaten the capacity of the researcher to draw accurate conclusions about the effects of interventions. If these characteristics are measurable, they can be called extraneous variables. Many times, however, the effects of factors that affect the trustworthiness of results are not even detected until after the experiment is complete, and they cannot be controlled or quantified. The presence of factors that jeopardize internal validity does not necessarily mean the study is a weak one. Virtually all studies have some rival explanations for results. The rigorous researcher attempts to predict those that might logically be expected to affect the outcome of the study and takes action to prevent as many as possible. Historical effects. Historical threats refer to events or circumstances that occur around the time of the introduction of the intervention, or that occur at any time during collection. Although the event itself may be entirely predictable, it can be expected to exert an effect on the subjects and, as a result, the study conclusions. Historical threats, a threat to internal validity because of events or circumstances that occur during data collection.